Well, only weeks with that report. Now, medics have warned that patients could die in Scottish hospitals because of the pressure doctors work under. The doctors are campaigning on behalf of a paediatrician who was struck off following a boy's death in England. And it's a case which could have implications here, as Gordon Cree reports.
Earlier this year, Dr. Hadiza Bawa-Garba was struck off. She'd been convicted of manslaughter after a 6-year-old boy in her care at a hospital in Leicestershire died. The junior doctor said mistakes were made because of the pressure she was under, working a long shift without breaks. There's been significant support from her throughout the medical profession. To date, their campaign came to Holyrood. Among those attending was a neurologist from Glasgow's Queen Elizabeth Hospital.
I have been a junior doctor in NHS 13 years, and I've lost count of those shifts where I have worked under this kind of pressure. It was just lucky I survived it and nothing harmful happened to my patients. But what Hadiza has lived, we all have lived those moments in our working experience in NHS.
Arguments about the health service are often roused between politicians in Parliament, but the campaigners here today are keen to stress that this is about real people. They say it affects patients in hospitals around the country, and that what happened in this case could have happened to any one of them.
It's really shocked us to the very core. Safety of patients is at the heart of every action that a doctor takes, and we want to make sure that tragedies like this don't happen again through supporting doctors and not turning them into criminals.
This afternoon, at a meeting arranged by Labour's Anas Sarwar, the doctors took their concerns to NHS Scotland's senior management.
The Chief Executive of the National Health Service and I and a number of MSPs have listened attentively and very emotionally to those testimonies. I think Scotland has a safety culture that has improved over the last 10 years significantly, and that was acknowledged in the room, but I think there is more to do. I think that journey will never be finished.
Dr. Bawa-Garba has been granted the right to appeal the decision to strike her off. Her fight has attracted hundreds of thousands of pounds in crowdfunding. Gordon Cree, STV News, Holyrood.
Well, Dr. Fiona Kinnan is from the Scottish Action Group for Dr. Hadiza Bawa-Garba. Dr. Kinnan, this seems to be an isolated case involving a junior doctor from England. What's prompting doctors here to take action?
You're right, Hala. So the case of Dr. Hadiza Bawa-Garba is one where a doctor has been struck off for the perceived errors in her care of a young boy who sadly died. And this case has affected doctors all over the UK, and we can see the implications in Scotland because we're concerned that our own medical errors may be criminalised. We're also worried about the effect it may have on recruitment and retention, not least of international medical graduate doctors, and also the impact on training and revalidation of doctors. We also need to educate the public in Scotland that doctors are human, and under significant workload pressure they may make mistakes. We'd like them to work with us to understand those, how we may learn from them and move on from them to make a safer patient culture.
Now, one of the issues that was raised was she's a junior doctor. She was under incredible strain. We've heard a lot about the pressures that junior doctors in England and Wales are under. But in Scotland, I mean, is that the case here? Are doctors here under the same amounts of pressure?
Absolutely. I'm no longer a junior doctor, but I've consulted with a large number of junior doctors during the course of this case, and all would be able to identify situations where they felt there were staff shortages or rota gaps, where they had increased workload, where they felt under more pressure, and where errors could therefore have occurred.
Are the problems in Scotland as acute as they are in England?
I don't have the specific numbers for Scotland compared with England, but I'm certainly aware that they're as common in Scotland.
Now, you were talking to MSPs this afternoon. What was their response?
Yeah, so this afternoon, a group of 11 of us who are concerned about Dr. Hadiza's case met with a group of MSPs and also senior officials from the General Medical Council, the British Medical Association, the Royal Colleges and various defence unions. Anas Sarwar, who chaired that meeting, has been very, very supportive so far of our cause. And at the conclusion of today's meeting, we were able to agree that he, as in Parliament, would raise awareness of the situation, that Professor Leach, the Medical Director for NHS Scotland, would meet with us and Shona Robison to take forward the situation, and we got a number of commitments from both the GMC and BMA about how they would look at safety procedures going forward, with the agreement that we'll reconvene in a further 6 months to see what progress has been made.
So are you optimistic that that progress will be made?
I think it has to be. I think this is a landmark case for doctors throughout the United Kingdom. I think if we don't see positive outcomes from this case, then the NHS going forward is going to lose staff left, right and centre. We're already aware of at least 20 consultants in NHS Greater Glasgow and Clyde who are international medical graduates who are considering going overseas to look for work because they are so worried specifically about the outcome of this case. So something needs to change.
And indeed, but you're very worried, of course, about the impact this is having on doctors, but in this specific case, a child dies. I mean, what would you say to the family of that child?
Firstly, what we would say is we are so sorry that any family ever has to go through the loss of a child. It's absolutely tragic, and let's never take away from that. What I would say in this specific circumstance, though, is that one person has been scapegoated for the death of this child, when actually, when we look closely at what occurred that day, there were systemic failures. There were multiple errors which sadly resulted in the death of Jack Adcock. What we would like to see is that rather than treating his death by blaming somebody, that we use lessons learned from his death to move forward to provide education for doctors and to improve patient safety across the NHS.
And just quickly, do you think there are lessons to be learned from that case across the NHS in Scotland?
Without doubt.
Okay, well, thank you very much for speaking to us from Edinburgh. Dr. Fiona Kinnan. You're watching STV News Tonight.